Hospice was something Terrence Bruce's sister refused to believe was their only option. How they went from end-of-life conversations to a second chance at life with a new heart. Good morning, I'm Alexis Del Cid. Welcome back to All Things Heart. This morning we have a remarkable story of advocacy. When Terrence Bruce had a stroke and then later heart failure, his sister refused to give up. Finally, she arrived here to the University of Kansas Health System and found the doctors who created the plan to save her brother's life. When Terrence Bruce is just hanging out with his sister and their mom, reminiscing about their childhood,
3 years old.
The conversation flows freely with plenty of laughter.
What was it like being her little brother? Did you do more talking, or was she always talking for you?
I always been the big sister, and he would remind me that I'm not the boss. So yeah, we're only 15 months apart.
At first, you won't notice that Terrence lives with aphasia. It's a residual complication from a stroke in 2019. He is fully himself on the inside. He understands everything, but his words can sometimes get scrambled on the way out.
Yes, sometimes words I can't. I'll go on my phone to see words. I could do that.
How to say them.
Yes.
How to spell them.
Yeah, sometimes.
And it's more pronounced when he's put on the spot.
So I'm nervous, like
Right.
the camera.
His sister Troisia has become his co-communicator.
There's times he said, you know, give me a minute, give me a second. And so then I know just to be quiet and let him finish his thought.
After his stroke, Terrence moved back to the Kansas City area to be closer to family. The stroke had weakened his already struggling heart. 4 years before the stroke, Terrence had gotten a pacemaker. After the stroke, his heart had only gotten weaker. By 2023, Terrence was really struggling. And a cardiologist at a different Kansas City area hospital gave Troisia some terrible news about her brother.
When he called to tell me that they were going to put him on hospice, I said, well, no, that's not an option.
Troisia asked if her brother could get an LVAD.
And he told me that 90% of the doctors would not do this surgery, the LVAD surgery. And I told him then I don't want to talk to the 90, I need the 10% that's willing to take the risk. I said, I cannot go back to our mother and say that I didn't try.
She then asked for Terrence to be transferred to the University of Kansas Health System. And that's where they met the team that would save Terrence's life. Cardiologist Dr. Herrick Shaw.
He was the advocate from day
Yes, for
one.
for real.
And cardiothoracic surgeon Dr. Tyler Zorn. Dr. Zorn and Dr. Shaw determined that Terrence could get an LVAD. Shortly after, Dr. Zorn did the surgery. And for 2 more years, Terrence did great, until one fateful day in the summer of 2025 when Terrence had a freak accident in the shower.
I have a cord right here.
Yeah.
As he slipped, the shower rod came falling down, somehow tearing at the LVAD cord. That's the cord that runs from the machine through the stomach directly into the heart.
So, of course, I went to the hospital.
But the damage had been done. Terrence developed a life-threatening antibiotic-resistant infection and was immediately placed on the transplant list. On June 19th, 2025, he got his new heart.
I'm doing good. I'm so glad I'm still here.
Still here and still determined to keep going, with so much gratitude, pushing through any obstacle in his way. It's emotional for all of us out here. That was a close call. I am so happy to have Terrence here and his sister Troisia. Thank you both for being here.
Thank you.
It was a tough road.
Yes.
You've come out of it. And we are also joined by Terrence's cardiologist, Dr. Herrick Shaw. He joins us virtually, and he'll be answering some of the transplant questions as well, because we'd originally also had Dr. Tyler Zorn, Terrence's transplant surgeon, on. Dr. Zorn, the good news is Dr. Zorn is saving another life. He can't be here because he's in a transplant surgery right now. So lucky patient to have Dr. Zorn. We're lucky to have him here. And we're going to just let Dr. Zorn do his thing. We'll handle the show this morning. First of all, Terrence, how are you feeling today?
I'm doing great. I'm doing great.
You look
Yeah.
amazing.
Thank you.
You look
Thank
happy.
Yes.
And you have your co-communicator with you, your
Yes,
big sister.
Yeah.
Tricia, because of the stroke Terrence had, you do call yourself his co-communicator, which is a gentle way of a big sister saying she still speaks for her little brother.
Absolutely, that's so true.
You did some pretty special things for Terrence. Terrence, your sister made some cards up for you that you carry around with you. Tricia, can you show the viewers the cards that you had made? I just love these. If you can zoom in on that card, it tells people whenever Terrence comes into contact with him, he can show them the card. And what does the card say, Tricia, that you gave Terrence to carry around?
It says, I had a stroke and I have aphasia. Aphasia is a language disorder that makes it hard to talk or understand what people say. It can affect reading, writing, listening, and speaking. It doesn't affect intelligence. And it has his name and his emergency contacts.
I love that. How did you know that those were something that you could have made up?
Well, when he first had his stroke, it was something very difficult for him, being an independent person, and he was still able to drive and do things, and I didn't want individuals to think that there was something else wrong with him, that he had a medical condition. And this always slowed people down when they didn't have patience with him. When he showed the card, then I don't know, it just calmed individuals down, and then they would listen a little more. Yes.
And it helps people take a beat and understand that you never know what the person in front of you
are dealing with,
has survived or has gone through. Terrence, I do want to just acknowledge how brave you are to come on a show like this, knowing that when you get nervous, the words kind of freeze up. And let's face it, this is not a natural environment to have a normal conversation. Just everyone gets nervous sitting on a desk with all the bright lights. So I just want to tell you how honored we are that you trust us to have this conversation with you, and that you agreed to be here.
Thank you.
Does having your sister next to you make you feel instantly more comfortable?
Yes, I have to.
When we talked about at the beginning Terrence's story, Tricia, you talked about how doctors elsewhere told you the only option was hospice, an end-of-life plan. What was that driving force for you to say, no, I want another option. I want the other 10% that might say, yes, we can do this?
As soon as he said hospice, as soon as they mentioned that, I wanted him transferred to KU to see if there was another option. I just believed, I just never believed that was it. And hospice, that was so final, and him being young. So I just felt like, let's get him to KU and see what they say. So
another motivator you said was you didn't want to go back to your mom.
That absolutely.
That's a strong motivator.
And that was really the biggest one as well, because I did not want to tell her that I didn't try. I didn't go as far as I could. Just because they said no, that just didn't work for me. I needed more than one. I needed more than one opinion to make sure that was the case. So.
And that was a life-saving push that you made.
Absolutely. Absolutely.
That second opinion that we always talk about. I want to go out to Dr. Shaw, because Dr. Shaw, the first thing you did was decide that an LVAD was an option. How do you explain an LVAD to people who are hearing about what an LVAD is for the first time?
Yeah, thanks for the question, and Terrence and Tricia, great to meet you. I'm not sure, great to see you guys again. I'm sorry I couldn't be there in person, and I just want to say this is an incredible story, and I want to highlight the fact that we're highlighting this because it's a great story. Terrence brightens every room. His pathway was not easy. He came in incredibly sick. He required a pump in his leg in the beginning. He required a pump in his arm before we could even get to the LVAD. He was very, very sick, and I think that aphasia was, a very, very important part in the beginning, because at first thoughts, when your heart is not working and you're not pumping good blood to your brain, plus the aphasia, it sometimes makes you think, okay, what's actually going on underneath? But it was very clear once we restored brain flow, good blood flow to his brain, you could actually see his personality come out and everything. You realize how great of a person and how incredible he is and how willing he is to fight. So The LVAD's a device, as you can see here. It's a device that gets implanted in the left ventricle at the very bottom of the heart. And it basically takes blood from the heart and pumps it through that white tube that you can see there that gets delivered to the ascending aorta. That pump runs continuously, and so it's able to really assist the left ventricle and most times do majority of the work for the heart. And for patients with very, very weak hearts, that's able to sustain them and provide them normal blood flow. The technology is incredible. It's kind of magnetically levitated, and so it's able to do this without causing a lot of damage to the blood cells. Then the big issue is that this pump has to be powered, and so as you can see at the very bottom, there is this what we call drive line that gets connected to the pump, and that has to get connected to a battery because this, as you can imagine, requires an incredible amount of power because this is going to be running, throughout the entire lifespan of the device. And so that cable then connects to the controller, which has the brains of the pump, and then it has the battery of the pump. And so basically there is something that comes out of the abdomen that gets connected to that powers the pump. But for patients who have severe heart failure, for patients whose heart would otherwise lead them to pass away, or consider conversations like hospice, this is a life-sustaining measure, and patients can have really, really good lives with this pump. And so he was a candidate for this pump after we did a thorough evaluation, and he did well at the beginning of the pump. He did, yeah. And then eventually gave him time to get to the heart transplant.
Dr. Shaw, what did you see, though, what did you see in Terrence that made you, when the doctor said, man, only 1 out of 10 people or 10% of the people doctors would say yes, what did you see that made you think, no, there is another option? Hospice isn't the only option.
Yeah, we're I would say, thankfully at our center, we've done a lot of what we call, LVADs and heart transplants in higher risk patients. And so that, some people may think it's 10% here. I mean, for us, the answer is always yes until we can find an answer to see why they're not a candidate, and so there could be challenges, but we're going to find ways around them. And I will say, Terrence did a great job. But I will say in the beginning, when he was very, very sick, Troshia played a big role. I think I was on the phone with her multiple times in the very beginning, trying to figure out ways. There were some challenges that we had, that were not specific to, Terrence. It was kind of, trying to figure out, which center can actually do this based on, employment insurance stuff. But I mean, we were on the phone, and I mean, you could tell right away that if we were going to get this done, she was going to be there lockstep with him, and that gave me a lot of confidence that we could do this because. This requires a team effort. You need support. And I think this is a great example where if you have good support, things go really well because you have an advocate right next to you. And so I think in the very beginning, she played a huge role. And then as he got better, he realized, wow, like we're actually, he's going to do really, really well with this.
Before we started this show, Troisia, you said, oh, Dr. Shaw, he set the wheels in motion and he pushed the truck. That's something right. Like that. What did you feel instantly from Dr. Shaw?
From the moment I met Dr. Shaw, when we came into the room, he was very direct and was talking about the options that we had. And just like he mentioned, that my brother was a little cloudy when he came in because his heart was so bad. And then the next day I came in, and Dr. Shaw, he said it was like night and day talking to a completely different person. And I knew that because he's my brother.
Right.
But we absolutely needed Dr. Shaw to see that. And man, when I can just say we're so thankful for Dr. Shaw because his advocacy made the difference in my brother's setting here today. I do believe had it not been for him, none of this would have been possible.
Yeah.
You agree?
Yes.
Pretty amazing.
Yes.
I want to talk about the accident. It sounds really painful when Terrence had that incident in the shower and the LVAD cord got pulled. I mean, we've seen how LVADs work on other people. It looks delicate. There's a pouch and there's a tube coming out of your stomach, and oftentimes, like, moms with little kids will have them, or we interviewed a grandpa who cares for his grandbaby and is holding the baby, and I always wonder how common is it that cord gets pulled, Dr. Shaw?
Yeah, that's one of the complications of the LVAD that is, probably the most common. And because you do have that cord that has to be powered, that connects to the battery power, that cord is inside, and then we try our best to secure it. We have a few anchor points that we kind of try to secure it on the body. But accidents happen, day-to-day life happens, and that cord can get pulled. And what happens when that cord gets pulled? Is the pump will keep working. There's no problem with the pump. What happens is that as the LVAD was placed, the body heals around the cord, and actually seals the cord away from the rest of the from the immune system and the blood supply and all of those things. So it's relatively protected because, but when the cord gets pulled, a lot of that tissue that was healing kind of gets disrupted, and then it creates opportunity for bacteria to come into the around the tube. And so when you pull the tube, it disrupts that protective layer, and then the incidence of driveline infection goes up. And so that's what happened is that integrity got disrupted, and so that driveline happens. And that probably happens, probably a quarter of the time in LVAD patients.
Oh, wow.
It's sometimes managed with antibiotics, and we can get a good handle of it. It's not life-threatening in the immediate sense, and so still the benefits for LVAD far outweigh that complication. Sure. That's why we keep doing it. But it is a common complication, and, if there is an infection that comes in that's very, very drug resistant, that is a reason then to take the LVAD out and put a heart transplant in.
So Terrence, when you had that accident in the shower, you said like a rod fell down. And
yeah, I have it was a little, like a hanger, and with a rod too. So the rod it fall. So I almost got it, but it still hurt a little bit.
Right.
But yeah, when like I said, it wouldn't hurt, but it wouldn't hurt. I mean, it was hurt a little bit.
Right.
But when I I'm sorry.
Okay.
When I went to sleep, go to sleep, I can tell it's really hurting.
Something was wrong.
Yes, I heard.
Yeah.
Yes, so I think I called.
Once you did it,
Called
you
her,
did.
my sister.
And sent me pictures as well.
Yeah.
And what
I
did
see that it was bleeding, but once it happened, we immediately called his care team about it, and that's when they prescribed the medicine, and immediately. But within a couple of days, it it wasn't doing well. Right.
Now, how long had Terrence had the LVAD before the cord got pulled?
Almost 2 years.
Okay, so it had been in there for a
2 years,
while.
yeah.
So Dr. Shaw was
it
saying
might have
they
been
were
2. Yes.
out of the woods. Something else that surprised me is you had said it wasn't excruciating. You weren't in. I was imagining it to be blinding pain, pulling on the cord, but it wasn't like that.
No.
So, Dr. Shaw, ultimately, you had to remove the LVAD because of the infection, and it wasn't responding to antibiotics. And Terrence received a transplant, but it was called a DCD transplant, which stands for donation after circulatory death. What makes that unique compared to other transplants?
Yeah, this is a great question, and I try to take some time because this is a very different concept when I think about heart transplantation. I think one of the many frontiers that we're doing here to kind of push our ability to provide this care to the population that we take care of. And so heart transplantation, typically occurs after, a donor has decided to, donate their organs. And when they pass away, they're able to donate their organs. Majority of the times, or all the times before DCD existed, is that the donors would have to be declared brain dead by, some sort of imaging test or a physician. And then we would do the heart transplantation. We do know that there are situations where there's irreversible brain damage, but the patient does not technically meet brain death criteria. But their other organs work very, very well. And so before, there was kind of hesitancy to use those hearts for transplant because the patients would have to pass away before we would be able to take those hearts. But with technology that we have now, what we're able to do is as the patient passes away, we're able to restore blood flow back to the heart and allow the heart to start beating again before we actually take it for heart transplantation. And so the benefit of this is that it's actually able to expand our donor pool. We do know one of the biggest problems in heart transplantation is that we have many patients waiting on the waiting list, but we don't have as many organs that those patients can receive. And so there are many patients who die every year waiting for a heart transplantation. And so one way to mitigate that problem is expand the number of hearts that could be available. And with DCD, that has the opportunity to expand the hearts more than any other intervention that we have done in transplant medicine to date, up to 20 to 30%, which is a huge increase when you think about the sheer numbers of that. And so, it requires a huge effort, from administration standpoint, from a surgical standpoint, from a perfusion standpoint. It is a big endeavor, which is why you don't see it everywhere across the United States. But luckily at KU, we've been in conversations to get this program up and running, and we were able to get this program up and running. And these hearts work very, very well, if not better, than the donation after brain death hearts. And so I think this is a great opportunity for our patients to stay less on the wait list, on the transplant list, and get good hearts that will allow them to live, long, fruitful lives. And so this is, relatively new at the University of Kansas, and so far it's been really, really good to see how this has impacted our patients and give them, again, the best opportunity to get the best heart and the best match possible.
It's truly transforming the landscape of how you do
definitely.
transplants and patient outcomes. I do want to talk about the video that we've been showing during the program. In case you're wondering what Dr. Zorn looks like when he's in action, that is video of another heart transplant that Dr. Zorn performed that we were allowed in to watch. And it was so cool to see this video and see the heart arrived and they removed the LVAD. And it's just fascinating. So if you want to imagine what Dr. Zorn's been doing all night and into this morning, it's that. Wow. He's been performing another transplant on a person just like Terrence. Oh, yeah. Pretty cool to see that,
yes,
right?
It is.
Never got to see, you don't get to see what it looks like because you're out. Right. You're getting the heart, right?
Yeah.
We have some great questions and some comments coming in. So if you have a question or a comment that you'd like us to read out loud on the program, you can send them to us on YouTube or Facebook or the All Things Heart email. You can find all those links on how to connect with us in real time right there on your screen. Now, Terrence, I want to share some of the pictures that your sister shot and shared with us. These are some images and videos of you in the hospital, not looking your best. Now look at you. You're amazing. Now that you're home and you're not there anymore in the hospital bed, what do you most love doing?
Actually, I like go to the gym all the time.
Nice.
Exercise.
Take your time.
There you go. Exercise. Yes.
Yes.
Yeah, I do it all the time. When I was a kid, I did the gym all the time.
Yeah.
Like for me, I'm good. Like, I'm trying to say in my head,
You like to be active.
Yes, there you go.
Always has.
That's what I do. Mm-hmm.
And so you go to the gym and you're back to doing what you love. That must feel
Yep.
amazing.
Biking.
Right.
Yep.
Oh,
That
that's
was hard.
great.
Yeah, that was hard for him not to be able to.
I'll bet, because before your stroke even, you talked about how fit you were and how active you were.
Mm-hmm.
What was it like watching the recovery process for your little brother?
It was watching a miracle. It was really watching a miracle unfold. And just watching him step by step, I understood sometimes. We had some tough conversations during that whole time, but one thing we never did was give up. That was never an option. I never thought down that line at all. It was always when it is going to be done, what we're going to do when you recover. And just seeing him now and that he smiles more now, we're just so thankful. So.
You do light up a room. The photographer I was with and we both felt instantly kind of charmed by you when we walked into the house to interview you. Dr. Shaw, you touched on this a little bit, but with how sick Terrence was, what does it feel like to be watching him on a television program looking amazing with his sister doing so well now?
It's amazing. It kind of gives you chills. It's hard to not be emotional when you think about the journey over the last, now 2 to 3 years. And I think I think it's a testament to Terrence and Troycia. It's a testament that he's coming on the show. I mean, speaking has always been, we always talk about it in clinic. We give him time, but when I talked to him about, I want to highlight the story, and he said right away, yes. Let me call my sister. Let's get this done. He does hard things. I mean, his recovery was never easy on both things, and he doesn't shy away from a challenge. And I think those are the patients. It's so easy to take care of those types of people who, hey, you tell them this is the goal, and they'll do whatever it takes to get to that goal. It makes my job and the team's job easy when you have someone who is fully invested in their care and who likes to take challenges on. And I mean, he's done that, and I think that's why you're seeing him up here sharing his story. And it's a great kind of culmination of everything that we've gone through since we first met.
And we honestly, before we get to community questions, we can't stress this enough, Terrence. You're the man. You do hard things. Imagine the thing you most dread that makes you most uncomfortable, and Terrence is doing it right now. He is not comfortable being put on the spot. Words get twisted on the way out. You know what you want to say. You're Terrence. On the inside, you're just, the words won't come out. And here you are. It gives me the chills just how cool it is that you are brave enough to do this. You've done all the hard things. I want to get to some of the community questions right now. We have a good one from John. John wants to know, does someone who gets a heart transplant need to take medication for the rest of their life? Dr. Shaw?
I feel Terrence can answer this question just as well as I can.
Okay.
Yes.
You do.
Yes. I have I have 3 medicine. Oh my gosh.
That's all right.
2 medicine. I know. Okay. I have 3, but one was I'm sorry.
Don't be sorry. Okay. You were on 3 and now you're on 2.
Right.
Is that what you're saying?
Yes. The one is what's it called?
Well, you don't have to name it.
No, you don't have to name it. But you have to take a couple of medications for the rest of your life. Is it a lot or just those 2?
2. I'm sorry.
Just those 2 medications?
Yes, 2.
Okay.
Yeah.
That's not bad.
Yeah. It was 3, but now just 2 now.
Okay.
Yeah.
So
and he explains that, in the beginning you're on a lot of medicines because we're trying to prevent rejection, and then as time goes on, the risk of rejection goes down, and so we do taper it down, like Terrence is saying. We do reduce the amount of medicines, but there will be some medicines that he will be on lifelong just to prevent that risk of rejection.
Well, you can do anything. You can do that.
Yeah.
Take a couple of meds. We have one more question from Becca. Becca wants to know, Dr. Shaw, how long is the heart not beating then before the DCD transplant?
Yeah. That's a great question, and I think that's the thing that we're trying to figure out. We have a certain period of time where over time, if the heart's not beating, we will not accept that heart because it's just too long. That varies depending on kind of how long the heart has been without oxygen, with low blood pressure. So it does vary, but we're finding that when you're able to put blood flow back to the heart and you see that heartbeat, you understand if it's going to work or not. So it's a moving target, depends on multiple factors, but there are multiple checks that we have in order to make sure that this heart will actually work before we actually take it.
As we get to today's takeaways, Troycia, I want to start with you. What would you want to say to Dr. Shaw, your brother, or even the family of the person who donated the heart to save your brother's life?
First of all, thank you, and we're extremely grateful of the chance that they gave my brother. I know this story could have been completely different at this moment, and for them to offer up the gift of life to someone else, we are extremely, extremely thankful. Every day I see him, talk to him. Our mother, when we talk to him, 2 years ago, we would have never dreamed we'd be sitting here.
Right.
And we're thankful to them every day, every day.
Terrence, how would you describe how you feel today?
Like I said, I'm doing great.
Yeah.
For real,
Great's a good answer.
Yes.
It's about as good as you can get.
know.
Great.
And it's interesting, through his journey, he's become more emotional.
Sure.
So, it's just, he always had a big heart, to be honest.
Yeah.
But during this journey, we're truly, truly thankful.
A lot of times guys don't emote outwardly as much.
Right.
So you've become a big softie. Is that what
Right,
your
yeah.
sister's saying? She's
Yeah.
telling on you.
Yes.
And Dr. Shaw, how would you like to wrap up this conversation?
Yeah, I mean, so many takeaways. I mean, Terrence is he's a testament to just being a great patient, a great person in general, and it's very fun to see him in clinic, and it's great to see him thriving, and it really is just, again, a testament to how hard he worked. And then, I mean, for Troycia, I think it's I mean, this is what if everyone could have someone like her in their lives, they're going to do a lot better, because I mean, there's every clinic. I mean, before Terrence would even speak to me, he's like, let me get her on the phone, and she's on speaker, even if she wasn't there, he's always there. Always there. Even if we're starting to talk, he's like, no, you gotta wait, you gotta get her on the line. And so every visit with him was a visit with her, and I mean, she was able to help navigate the processes. There were some times that we needed her help to get some things done, and she was able to get that done. And so just, again, it's just, I mean, if you have someone who cares about you that much, it means a lot, and you're going to do so much better if you have someone like her. And so, again, I don't think this is possible. They say it's not possible. I mean, our team was half of it, but it's those two that you're seeing there that, had to walk the walk. And I think without they both had to do their part. And if one didn't, it wouldn't have worked out this way. So it's truly a team effort here.
Yeah.
Dr. Shaw, thank you for your time.
Thank you.
Thank you.
Thank you.
We're sending
course.
good
Hey,
vibes to Dr. Zorn.
I'll see you guys in clinic at some point, yes.
Okay.
All right. Thank you, Dr. Shaw.
All right, thank you.
Good vibes to Dr. Zorn, who's performing a transplant surgery right now. Lucky patient. And thank you so much to Troycia and Terrence. Thank you for being here. It's truly an honor to have you on the program.
Thank you.
And coming up tomorrow, fighting cancer before she was even diagnosed. Investigative reporter Kristen Crowley learned she's genetically predisposed to cancer. We followed her medical journey from exams to surgery. You'll see it all tomorrow at 8 a.m.